Thank you. Thanks so much. Well, good morning. Thank you so much for the opportunity to be here today. I'm really excited to talk to you about how technology can change and inspire heart health and brain health. But I couldn't be at this meeting today hosted by partners without mentioning something really important. The photo on your left I saw on Twitter on October 15th when the Massachusetts General Hospital was announcing the 100th anniversary of the cardiology department at the Mass General, founded, of course, and seeded by Dr. Paul Dudley White, who set the tone really for what prevention meant as he rode his bike to work every single day and was such an icon for prevention. Well, Paul Dudley White was also one of the 5 founders of the American Heart Association. And so on this celebration for the Massachusetts General Hospital and partners overall, it's a wonderful link and synergy for the organizations to come together. I want to talk with you today about do-it-yourself heart health and how technology can inspire better heart and brain health, but I have to start by talking about the problem that we face in cardiology and in cardiovascular diseases overall. This graph shows you the highest risk factors associated with lifespan impact in terms of years of life lost. And if you look at those in red, you will see a number of the risk factors for cardiovascular diseases, including heart disease, vascular disease, and stroke. And right at the top of these, dietary risks, high blood pressure, tobacco use, body mass index, high blood glucose, a little bit further down the list, blood cholesterol. So even though Dr. Paul Dudley White has been preaching the power of prevention for 100 years, we still have these tremendous problems in society today. And this is why my organization, the American Heart Association, has been very focused on inspiring a new movement towards prevention, especially with the goals of the AHA to improve the cardiovascular health of all Americans by 20% by the year 2020. We've been very focused on creating new ways to inspire consumers to do things like regulate their blood sugar, their blood cholesterol, manage their blood pressure, maintain a healthy weight, get enough exercise, eat a healthy diet, and of course to make sure that they don't smoke. Now, all of these together, we kind of call it a portfolio of activities that people need to do to have ideal cardiovascular health. And the truth of the matter is very startling, that as we sit and stand here today, when you look at the bundled effect of these 7 health factors and health behaviors, fewer than 1% of the American public is in ideal cardiovascular health. That means that fewer than 1% of people in this country have all 7 of these health factors and health behaviors at an ideal rate. And so, of course, at the AHA, we're very focused on how we can use technology to create a new way and new solutions for individuals to manage their health. And we certainly, like all of you, recognize that technology can be the game changer if used correctly. These statistics are no surprise to this crowd, but I always like to just remind ourselves that $4.5 billion was invested in digital health technology, over 100,000 health apps, and in 2014, spending on digital health technologies overtook spending on medical devices. That's very significant and provides us a real opportunity. And we know from these studies that mobile apps are becoming a regular part of patient care. The last panel on telehealth was really interesting and very inspiring. And I think when we at the AHA see this data, that 86% of clinicians believe that mobile apps and technology can become an important part of how they interact with patients, that to us is very promising. The thing that we're thinking about, however, is if you look at the left or at the right side of this slide, you'll see that physicians, as surveyed, see the use more for things like, using for diagnosing ear infections and urinary tract infections, and a little less confidence in monitoring vital signs. And so we have some work to do to create an evidence base to show that these technologies actually can do that. And if we look at what patients or consumers want from these mobile technologies and how they're being used now, it's great that they're being used for fitness and medical reference, wellness, nutrition, Again, all things that are very important to prevention and things that we at the AHA care deeply about. When you look on the other side of this slide, though, you'll see that most patients who are using this are looking for information related to symptoms and medical conditions and an opportunity to interact with a healthcare provider, not as much actually using them to improve the status of their health directly. And so that is for us a real opportunity. This is why the American Heart Association, just in September, even though we've had a long history of working in health technology, in September we created our new Center for Health Technology and Innovation so that we could bring together 3 or 4 things that we think are core and fundamental to the opportunity the American Heart Association has to contribute to this field in a positive way. Certainly increasing engagement. This is something we do at the AHA all the time, 33.5 million volunteers and supporters in this country, improving outcomes, especially building on the science expertise of the 33,000 science volunteers of the AHA, and of course trying to demonstrate lower costs. These are all things that we'll be doing in our Center for Health Technology and Innovation. And because of technology, we know that consumers are moving out of the hospital and even the current healthcare system into this home-based care health ecosystem where there's an opportunity for all of these solutions to really be connected together. And as we think about the big opportunity, the grand opportunity, we believe at the AHA is both to provide the evidence base of what works, but also to find a way for the person in their everyday life that these tools and solutions become seamless, become a way that they're living their actual life. And we know, for example, in talking to healthcare providers, they have a lot of questions. Are EHRs helping or hurting? Are patient-facing digital tools useful for my patients? And if so, which ones? Which tools will provide better and more cost-effective care and allow more time for me, the doctor, to spend with my patient? These questions are unanswered. And from the patient or consumer's point of view, what does this data mean? Am I healthier because I use this? What digital health solutions work? Which are meaningful and which ones should I use? And how do I share the data from my own health technology personal tools with my healthcare provider? Do they care? Does it help? These are all important yet unanswered questions that we at the AHA intend to do our part in helping to answer. And we started that by this editorial published in JAMA back in September of 2015, led by several AHA volunteers that talked about how mobile health applications can facilitate meaningful behavior change. But the outcome of this and the call to action really from this document is that these massive health problems that I outlined earlier require pragmatic, scalable, and evidence-based solutions. And so when we think about bringing solutions to scale and demonstrating which solutions actually work, this must be a focus of all of us in this room, and certainly it is our focus at the AHA. Now, let me tell you a little bit about some of the technologies we've created directly at the AHA. One thing you may or may not know about us is that we, along with several other international organizations, lead the process for creating the standard of care for first aid and CPR. I hope all of you know CPR, an important life-saving tool, technique. We have created a number of technology-based solutions for CPR training, both in-hospital solutions that allow healthcare providers on a quarterly basis to test their skills in a resuscitation quality improvement program, but also for the public with our first aid and CPR app, where people are able to know and understand the basics of first aid, and this will walk a person through how to administer CPR if a person is a bystander and is in the situation that they need to administer CPR. And our guidelines published 5 years ago, of course, allow individuals administering CPR to do hands-only CPR, so the mouth-to-mouth in a bystander situation isn't necessary. And this technology has saved lives and has provided valuable information to hundreds of thousands of people who are interested in knowing and understanding first aid and CPR. We focus a lot on kids and children's health, a big, important priority of the American Heart Association, and we have partnered very proudly with the National Football League and their Play 60 program, which is where the teams and the athletes are very involved in their communities and the schools with kids, inspiring a generation of kids to care again about physical activity. But we've also created this Play 60 app, which is the most downloaded app among children ages 10 to 14, with just about 1 million downloads last time I checked the data and information. And this app actually allows kids to exercise with the app. So it's not something they're sitting and playing, it's something that gets them up and moving and ties into, America's campfire, NFL and the NFL players. Blood pressure management is an important priority for the American Heart Association. We've had a number of iterations of technology for blood pressure management, and as a matter of fact, back when the Microsoft Health Vault was first starting, we were the first health app and health technology program on the Health Vault with our blood pressure management programs. This program, Heart 360, has had well over 100,000 users and also has demonstrated actual lowering of blood pressure when there is a patient-physician interaction. And we have a couple of papers that we published in a study that was done at Kaiser Permanente, Colorado, that showed that using Heart 360 in a regular interactive way between the patient and healthcare provider significantly lowered blood pressure and allowed that blood pressure to stay lowered through the duration of the use of Heart 360. And we've replicated that study in Raleigh-Durham, North Carolina, and in other settings and throughout the country. Because of the American Heart Association's broad grassroots reach, we're very focused on blood pressure management and making sure that technology can inspire individuals to have tools that they need to manage their blood pressure. We're also at the AHA very focused on workplace health solutions. So many people go to work every single day, and we have to help employers make the workplace a healthier place so that people that devote so much of their life to their company and to their job have an opportunity to have good health in the workplace. And the great news is we've done a number of studies of employers, a number of studies of employees, and this is a very big priority. It's a big priority for employers who are worried about engagement, especially of younger workers, and making sure that they're adding value to the lives of their workers. And it's a very important priority for employees to feel like their company cares about them and is providing solutions for their entire life. And so with our My Life Check tool at the center, which is an evidence-based risk assessment tool that's both mobile and desktop enabled, we have created this entire program that allows individuals to interact with their technology and focus on those 7 health factors and health behaviors that I mentioned earlier. And importantly, it allows companies in a de-identified way to be able to create competitions within their company and between companies. And this past summer, we piloted, and in February, we will be officially launching a nationwide workplace health recognition and awards program based upon an index that includes a number of criteria for the environment of a company, but also measuring the actual health status of employees in a company, and is it improving from one year to the next? And we'll be able to use tools like the My Workplace that will be offered in the My Workplace Health Solutions program of the American Heart Association to provide this data. And because we are a science-based organization at the AHA, we will be doing a number of outcomes studies to make sure that we can track not just one-time improvements in health, but sustained improvements in health over time. So the AHA Center for Health Technology is busy, and we're focused on a number of risk factors and health behaviors and a number of technologies. And these areas are the focus of the AHA. We intend to, significantly invest and scale our efforts in these areas because we believe the combination of our science, our brand, and our ability to convene experts provide us this platform to be able to make a difference in all of these areas that are listed here. But as we're doing all of this work, the thing we know and you know is that the world is changing quickly. You know, when you hearken back to 2003, which it doesn't seem that long ago, and even look at the difference between 2014 and 2016 and how people are actually spending their lives. And, you know, this is one message I wanted to make sure to leave today. I think all of us get very focused on the solution or the tool or the idea, you know, that we have. But we've got to stop and think about how are people living their lives, and how does what we do and what we're creating in this march for better health, and for us for better heart and brain health, fit into what people want to do in their everyday life. And, you know, it's wonderful to see the rise in the number of health apps from 2014 to 2016, you know, 100,000 to 165,000 apps, and very hard to know and understand how many users of those apps there are, how many regular users. But look at the growth worldwide in things like Facebook, you know, from 0 to 1.2 billion to 1.7 billion users. Or even Instagram or Twitter, you know, Instagram in 2 years from 160 million to 500 million users. This is where people are spending their time. And so the challenge for all of us is to think about how we take what we do and fit it into how people spend their time. You know, consumers have many choices of what they can do every single day. And monitoring their health with our technologies is one thing. But how does being healthy and living a healthy life really fit into the things that are why people you know, get up every day? And these are the kinds of things that people choose to do with technology, perhaps more than the kinds of things we wish they would do. You know, I was interested in studying how social connections matter. And so even though all of this technology has come to the forefront of all of our lives and has really, you know, dominated the way we live our lives in many ways, you know, I'm convinced that if we go back to what humans really want, which is this human-to-human interaction, even if that's being done now through technology more than the old-fashioned way, you know, pick up a phone and call somebody, or, you know, go knock on your neighbor's door and sit down and have coffee. You know, these things don't happen the way they used to anymore. But the social connections are happening through all of those technologies I just mentioned. And we've been monitoring very closely about how health can change when we embed our ideas, our guidelines, our technologies into these existing channels and create users who are creating a social community for each other. You know, there are studies that show that quitting smoking is easier for social media users, how Twitter can help smokers kick the habit. You know, people are quitting smoking within 6 months of creating a community on Twitter. You know, social media being used to help people battle weight. And we see this ourselves at the AHA. One of the big social media activities that we have is through our Go Red for Women campaign, which is a campaign that we created 10 years ago to help women understand that heart disease is their greatest health threat. And through Go Red for Women, we have a technology-based Get Fit program where women are coming together through social media, helping each other stay committed to their exercise and diet routines, and we're actually seeing evidence of weight being lost. And so in this case, we didn't have to go create a separate technology, a separate app, a separate anything to make that happen. We had to integrate the power of social connections in these existing technologies and build communities of people that want to help each other. And we believe this is an important area of focus and something we'll be doing at the AHA. And we're also thinking a lot about how experience to the customer matters. You know, as a marketing person by background, you know, it's interesting to see how often we forget to think about the customer journey and what they want when these new health technologies are being created. And so that certainly is an important area of focus for us, and certainly I hope for all of you. I like this picture as an example of that. You know, there's a lot, and we at the AHA and our advocacy work are focused on the built community and designing healthy communities, but here's an example where the designers didn't stop and pay attention to what the users wanted, right? And so we've just got to make sure that we are constantly doing that. So, to sum up, the AHA, we see ourselves as the catalyst using our science, content, brand, reach with collaborators and through health technology. And I'll close today with just one big announcement that was made earlier this month, but again, it ties into partners, so I wanted to make sure to do it. Last year, in November, we announced our One Brave Idea research collaboration, a $75 million prize to one leader who had a vision and a team to find the end for coronary heart disease using new technology-based ways to do science, to engage patients, and to help us understand the things that we don't understand now. And we announced on October 4th that Dr. Callum McRae, the gentleman with the glasses right there, Chief of Cardiology at the Brigham and Women's Hospital, of all the applicants that we received, 350 applicants from 26 countries, Dr. McRae made it through the very rigorous review process and is now our assigned and appointed One Brave Idea leader, and the One Brave Idea team, the American Heart Association, Verily, which is formerly Google Life Sciences, and AstraZeneca. Each of us have contributed $25 million and the resources of our three organizations to seed this work. We will be doing that right here in the Partners Healthcare System, creating the One Brave Idea Science and Technology Innovation Center under the direction of Dr. McRae. Thank you very much. I appreciate the opportunity and look forward to spending the rest of the meeting with you. Thank you.
Fantastic.